Welcome to OCD Whisperer podcast. And today I have Lauren McMeikan from OCD LA. And today we're going to be talking about core fears and OCD. Welcome, Lauren.
Thank you so much. It's so good to be here.
Yes. And so I actually am going to start by saying that as we just jumped on this call to say hello to each other and meet each other, we kind of started diving into this conversation. And I was like,
Totally.
wait, let's start because I think this will be actually really interesting for people to hear. And we were just talking about just kind of the concept of core fears and from the CBT lens, which I want you to say what you were just saying before, because I thought it was really awesome in terms of kind of the main buckets and beliefs. And then specifically when we get into OCD and kind of some of the core fears that show up there that we
Yeah.
both maybe see. So why don't you go ahead and tell me again about like some of the three kind of main components you see in CBT and that show up, like I mentioned, like sometimes in depression or when folks are just having more generalized anxiety or
Right.
kind of low
Right.
self-esteem, things like that.
Yeah, absolutely. So it's interesting because it's coming from the sort of core beliefs realm, right? So within the realm of traditional CBT, and I think it's Judith Beck's book, about, I think it's called cognitive therapy or cognitive behavioral therapy, but she talks about these three major buckets, right? Of, I think it's worthlessness or unworthiness, helplessness, and unlovability as the sort of central themes that tend to underlie these negative core beliefs, which are obviously problematic. If you have a core belief that you're helpless, that's going to prevent you from undertaking things that are going to help you get better, and unlivability, worthlessness. I think it's all pretty self-explanatory. But I know that we were also talking about the fact that within the realm of OCD, this idea of core fears comes up in a lot of different ways depending on whose work you're reading. And so, yeah, I'm definitely interested to sort of talk about that as well.
Yeah, and you mentioned a couple of different folks. So for me, I did training with the Behavioral Therapy Training Institute through IOCDF, and one of the topics was discussed by Dr. Polak, and so he mentioned that not that this is an evidence-based um, kind of studied process, but that he noticed for himself that there seems to be kind of these main core buckets in OCD that tend to show up a lot, which happens to be one is a core fear of death and dying, another is a fear of loss, abandonment, rejection, another is fear of some sort of spiritual dismemberment, and another is some sort of a being stuck in some sort of a permanent state or in something that seems indefinite.
Hmm.
And so it can be a combination of those, but typically it tends to be somewhere in there. And so since that training, I noticed that in my practice, quite often, in fact, when I'm helping folks with OCD start to study their OCD and look at themes that are showing up, because I always tell people it's really thematic and it's repetitive. And once you start to pay attention, you start to see like, where does your OCD typically take you? Is it always taking you to some sort of death and dying process? Even if it's responsibility OCD, right? It can take you to that you're going to be responsible for killing other people
Mm-hmm.
because you didn't, inform them earlier. Or relationship OCD, of course, a lot of fears around, abandonment, rejection, right? Um,
Mm-hmm.
you can have health focused themes where it can be that somehow like something's off in my body or somebody didn't catch it, and what if I get stuck in this, and what if it'll never be fixed. So there's those forever buckets, right?
Yeah.
Or of course with religiosity, right? That somehow because I had some bad thought or a sexual thought or something like that, like, God's not going to accept me, or my soul's going to go to the devil, or somehow I'm tarnished, or something like that. So they do tend to show up in those ways. And I've definitely seen it. So that's from just clinical experience that I've had in terms of also, like I said, listening to that presentation. But I wanted to hear your kind of notions or ideas or thoughts or what you think about all that.
Well, so it is really interesting because I've certainly seen this in a lot of individuals and sort of with a variety of themes. Because as you mentioned, right, like we do tend to see people with a variety of themes. That so, for instance, I'm thinking of somebody who I worked with POCD and hit and run OCD, and it was this the sort of the core fear was related to this idea that she was going to be a bad person, right? So this being bad fear, which Dr. Yadin talks about, which is a little bit different, but I feel like there's so much overlap in terms of these sort of buckets that we're talking about. But going back to this particular case, right, that there's this core fear that she's like inherently a bad person, right?
Yeah, that actually
And
goes in that whole, and I know it's a spiritual dismemberment, but it actually slash like morality,
moral,
which
yeah,
that kind of goes in that clump. So yeah,
definitely,
sorry, yeah.
yeah. That's exactly, that's so interesting. So essentially, there are these two very different fears that so both fit into this one category. And I think one of the main reasons why it's important to look at core fears is that when we look at all of these different worries, and then we also look at all of the different compulsions, that it can feel really overwhelming to people. How am I ever supposed to overcome the fact that I'm afraid of hitting somebody, and I'm also afraid that I'm going to molest a child, right? Like, this feels like a lot. And then again, you start to really break down into a hierarchy, all of the different compulsions that a person is doing and all of the avoidance. And when you find this sort of central line, it's a parsimonious way of explaining what's going on, and it starts to feel a little less overwhelming.
Mhm.
Besides the fact that it's really important because let's say you've got somebody with harm OCD who's afraid that they'll be unable to live with the guilt feeling for the rest of their lives if they hurt somebody, versus somebody's going to die and they won't be able to be with them anymore if they kill them, right? These are two different fears, even though it may be the same action that is feared. That
Yeah.
makes sense.
Yes, yes.
Yeah.
Yeah, and even as you're talking, I'm kind of thinking too, like if somebody's more depressed, right? And there's this thing about like I'm worthless, or
Yeah.
I'm not good enough, or I'm unlovable. That's very drastically different, and in terms of how it's going to impact also your behavior and your emotions versus in an anxiety disorder like OCD,
Right.
where everything in your behavior is really all about trying to prevent that bad thing that your brain says could happen from happening.
For
Um,
sure. Although I feel like they can certainly overlap, and that's
oh yeah,
not dissimilar from what we see in our offices, right? That people have often have comorbid mood disorders when they have anxiety disorders. But and certainly interesting to see how obsessions can play into, like, for instance, if you take the sort of core belief of worthlessness and then you start having these intrusive thoughts about, I don't know, why do I keep going back to POCD? But like, like they keep going back, or if the concern is that you're going to molest someone and that thought pops in, that you're going to likely feel some shame and a sense of worthlessness related to that. You and I both know that that doesn't mean anything about the person, but that doesn't change the fact that in the moment that worthlessness schema tends to
well,
pop in.
exactly, and I think that, and that's where you can again feel depressed, right? Because oftentimes you can have these two things happening, and then sometimes, at least I've noticed that when addressing and helping a person understand their OCD and really, really recognize how to separate from that part of themselves in a healthy manner, like a healthy detachment, where you can recognize, like, okay, I'm having these thoughts, they're intrusive, but now I understand the nature of intrusive thoughts. I understand that there's no and there's no deep meaning about them. There is no rhyme or reason why. It's just something that happens. It happens to everybody, but to me, it happens a bit more than not because of the way my brain is set up. So you can really understand and wrap your head around it, right?
Mm-hmm.
And then why you're feeling what you're feeling, like, okay, it's triggering my flight and fight response. So my alarm system's going off. So yeah, obviously I feel like intuitively I have to do something about it, but now I'm learning that I have to kind of go against my intuition, my organic response, because
My
it's actually
instincts,
the
yeah.
wrong time at the wrong over the wrong thing. So okay, I'm learning how to decipher that, right? And so once we help people really grasp that and how to work with that and differentiate, oftentimes a lot of things I've found, I see it kind of tend to resolve because suddenly you're not feeling as depressed because now you understand what's happening. Now, that's of course different than when somebody actually has, clinical depression. right? Um,
Sure. Although certainly one can inform the other. And I think it's interesting that I agree with what you're saying, that it's so important to educate people at the front end of treatment that your thoughts aren't inherently meaningful. And yet, and I don't know if maybe I'm going off topic a little bit, but it's interesting because a lot of people still question whether or not but maybe they do. Maybe they do mean something. And that's where,
of
the
course.
OCD can start to attack treatment, which is a whole
Of
other
course,
can of
especially
worms.
with OCD. Yeah, you're gonna doubt everything,
Yeah.
including treatment,
Including the
including your
disorder.
thoughts. Are you?
Yeah.
I don't know.
I know, it's such a
Um,
beast. It's such a
oh
beast.
man. So coming back to core fears, one of the
Yeah.
questions that I want to ask, and because I always love to give my audience at least one tip, something they can take with them. So when we're talking about core fears, is there something you could offer, like a suggestion or a tip or a strategy or something? How could somebody who is listening, who is experiencing OCD, intrusive content, how could they identify a core fear and what's actually happening?
Yeah. So I think it all comes down to figuring out what the absolute worst case scenario is. And I think that actually oftentimes that'll come up in writing an imaginal exposure, right? That you're really just trying to get down to, what am I afraid is going to happen? And if you start to find the, what am I afraid is going to happen? Like, what's the worst outcome here? That can inform you in terms of, especially if you look at them across spheres, if you happen to have a lot of different thematic intrusive thoughts, that if you start to look at what that worst case scenario is across a lot of different fears, that you tend to see themes. You
Mhm.
tend to see, oh, there's a sense of responsibility, and if they don't take the responsibility, then it's going to end up in, you know, their moral dismemberment, right? Like that you were talking about earlier,
Right.
or that, yeah. So I think from my vantage point, it really comes down to getting at, what is the worst case? What is the end of this story that you are unwilling to have happen, that you keep doing compulsions in order to avoid? And that usually, I think also the buckets that you mentioned earlier are very helpful in that regard, because if people know kind of what they might be looking for, right? And we were talking before the podcast, I think Dr. Greenberg talks about like a very four similar categories. Trying to think offhand, and I think actually he talks about it, and that they're Dr. Yadin's. So there's death, suffering, being bad, and there's one more that I'm missing actually. I have it noted somewhere, I think. Oh, ruining, of course, ruining, like this sense of causing some sort of irreversible damage. And that if you know that your core fear is likely to fall into one of those categories, then it's going to help to train your attention on what's most important, like what to sort of draw out of your fears to get the core fear, if that makes sense.
Mhm. Yes, honestly, everything you just said sounds like it really kind of overlaps with the ones
Exactly.
like a Pollock. I'm like, oh yeah, they actually all go together. It's like slightly different way of saying the same thing. Um,
Exactly.
and yeah, I think if I understood you correctly, what you're saying is that when you can kind of drill down and recognize and see which one of these is actually playing out or which one of these is coming up, it's almost like you're learning a language, right? So you get really familiar, you learn what it sounds like, what it feels like, so that then you
Right.
can recognize it much faster and kind of separate yourself from it and go, oh, that's my OCD talking, oh, that's my fear brain, there it is again. um
Right. Right. Well, and it's just, if I say go find your core fear, but there's no sort of, this is the sampling of what that could look like, then it's very difficult to know what that is, or to find it. Um, yeah.
Yeah, so you're saying like when you have these to look like you're looking for this, so then it becomes easier to kind of know what you're looking for, and then it's like you can decipher. Then you can start to see like, yeah, where does my brain continuously take me to? Yeah, this
Yes.
I think honestly, I had a client I worked with, and it was a contamination element, but the fear was that this person would be like patient zero basically was going to be the one percentile unlucky one that's going to basically get everybody sick and like wipe out California.
Oh, wow.
So we started, we had a good enough rapport where I do like to use humor sometimes. So like
Totally.
we had a session in the morning and just kind of was looking more serious. And I looked at her and I said, "Oh, what's happening? Are we wiping out California again?" We could laugh a little bit. And I was teaching her too to say, look, like it's okay to have a little lightness and levity. Like it's okay to have that kind of relationship with your OCD. Kind of recognize like, yeah, there goes my OCD again. Like, yep, apparently I'm wrong again. Or yep, apparently I'm killing everybody. Or yep, apparently I'm I'm molesting everybody. Apparently I'm I need to be locked up again.
Right. Totally.
Like,
Totally.
go.
Yeah, absolutely. I think being playful with it can be really helpful. And at the same time, at the core of it is accepting the uncertainty. So you don't want to necessarily use all that, the sort of sarcastic vibe to, I don't know, to sort of reassure yourself in a sense.
Well, exactly what you just said on the nail of the head. And I think I'm glad you said that because that's always a disclaimer that we have to give. Like you can be light, but this is one of those disorders where always be attentive and present in what you're doing and how you're doing it. So it doesn't become a compulsion because
for sure.
Compulsion can easily sneak in, right? A person can easily use psychoeducation compulsively, or they can use it compulsively versus the way I just described and am intending it more like, hey, sometimes it's okay to laugh a little bit. It's okay
100%.
to but exactly right. But not start to lean on that as a thing to make you feel better and reassure and and kind of say, oh, no, it's fine. It's fine. This is OCD. This is OCD. It's like, no.
Right.
Who knows, right? I always
we
come
don't know.
back to ultimately that I'm willing to sit with just not knowing for sure. But
absolutely.
Awesome.
And I think the thing is that sort of at the end of the road is just what you were just saying, right? Is accepting uncertainty, accepting that you don't know. And the beautiful thing about finding the core fear is that once you accept, you know what, maybe I am a bad person. Maybe I am, right? And feeling all those feelings that come along with this idea that is really scary and that nobody likes to not know, but it's particularly pronounced for people with OCD, that's where freedom is.
Yeah.
Right? And I think it's interesting because one of the benefits of looking at core fears is that when you accept the core fear, if you accept the possibility therein, it generalizes to all of the individual compulsions.
100%. I totally agree with you 100%. And the fact is that it's actually, I know we just kind of joked a little bit and that's one example, but the reality is when this is actually happening live, it's usually very intense and it's very scary and you're in a state of a lot of anxiety and it really is so unpleasant and it feels so bad. But like you said, it's again, it's really bringing awareness and recognition to what's happening to you so that you don't just fall into it. But you could see it for what it actually is and go, okay, like this is a hard moment right now, but I also know what this is. And really,
or I'm willing to accept that I might, right? Like that I don't know for sure, but
well, I meant like, yeah, when you're meaning like, I know what this is, meaning like I'm having an anxiety disorder, it's my OCD brain, meant more that process of what you're feeling that, and then like whatever comes after that, which is like that, maybe I'm bad, like the example you gave, or like, oh my God, maybe I just did something terrible and now everybody hates me, or maybe now or maybe something, catastrophic is about to happen.
Right.
And really being able to just sit with that and choose to not answer that question.
Yeah, absolutely. And I think I get where you're going at, what you're going for now is the knowing I know how to feel this, right? Like I know how to feel this feeling. I don't have to get rid of it. I can just make space and it's okay.
Exactly right.
Yeah.
Exactly right. Yeah. Awesome. Thank you so much. This was, I think, a really fruitful conversation. And I know that, with OCD, it can feel complex at times, but also there's certain processes and structures that are repetitive. And once you really learn what those are, it can get a little easier to know how to work with yourself. But yeah, core fears, man. Whew.
I know. Well, thank you so much for having me. I agree.
Yeah.
This was a fruitful conversation and
Thank
glad
you.
to get to talk about it.
If people want to find you, where can they find you?
So I am on Instagram, and I have, I guess my handle is at the Obsessive Mind. So I try to post there regularly with tidbits about life with OCD and anxiety disorders, and sometimes throw in eating disorders as well, because I work with people with eating disorders. I work at OCD Center of Los Angeles, which you can find us online at ocdla.com. And yeah, I think that's pretty much the gist. Oh, and I have a website, theobsessivemind.com. It's another
Perfect.
place. Yeah.
Perfect. I'll include all that, of course, in the show notes. Thanks so
Awesome.
much.
Thanks.
Bye.